fast forward, any come out our channel so Shannon Swam say I have say age politics have it. When you have political source at training because make headlines. Near Jembre na afe yedi bi exomo ewa any dem ni black seven say and then AD the Kanyam. Structure bit me I subscribe to the channel. But my so with my notification bell share na afro so answer into me kebi any dem best rock say onia young political habits na honorable Addo and what say NPP amayuko no instance say omu elambashi NDC amayuko on cocoa crisis esenke ye punish omu a enya asem koto akra na insem okay nyina ne say omu ana akofa sa crisis we say nyina e di abakoko board a onia current government yi e buy akuma owura randi abi ehu e papa na onia enya asem koto na insem okay nyina ne say impo $8.5 million cocoa sacks are friends the jute sacks omu procure ya onya na ehu hia ebu hwa ameno ka sei ebikura ewo porta omu entimi outlet and free port ni nyina ayisika omu echedi ye intra besere sei mu wura owura nsim abra wajemre na osuja edigu nsim ha eji
They only went and cleared 91,000 of them and left the rest at the port. Meanwhile, they also had 75,000 bales of juice sacks. So add that to what is in the port. They had enough to last them another 3-4 years. But just a few days before they left office, they went and contracted and paid 48 million to bring in 80,000 bales of juice sacks. These are reckless people. It is the conduct of these people that denied the government of Ghana the resources to properly take care of you at this point in time.
As part of government reforms, a new cocoa board bill will be presented to Parliament to introduce an automatic adjustment of producer prices based on world market trend and exchange rate. The legislation guarantees farmers a minimum of 70% of the gross FOB price, ensuring protection against global price fluctuations. Also, cocoa board's 4.35 billion Ghana cedis in road construction liabilities will be transferred to the Ministry of Road and Highways and the Ministry of Finance, relieving the board of non-core financial burdens.
In a related development, organized labor says it will engage government and the management of cocoa board over measures aimed at addressing ongoing challenges confronting the sector. Daniel Opoko, our labor correspondent, reports.
Management and senior staff of the Ghana Cocoa Board have taken a 10 and 20% pay cut in a move aimed at raising funds to support the struggling cocoa regulator. The decision, according to Cocoa Board, is intended to mobilize about 40 million cedis over an 8-month period to help defray debts owed to suppliers and other stakeholders. Head of Public Affairs at Cocoa Board, Sam Jerome, says the salary reduction is a necessary step to revive the operations of the board.
We are looking at no less than 5,000 people, and out of these 5,000 people, the simple mathematics would give us no less than 5 million Ghana city savings, and we have just about 8 months. So if from now, February, March, April, May, June, July, August, September, we have about 8 months. So 5 million, 5 times 8, 40. So at the end of the period, tentatively, we should be saving about 40 million Ghana cedis, which is very huge or substantial.
He further disclosed that management is considering a comprehensive audit of staff strength to improve efficiency.
Already, he has called for an HR audit for him to ascertain whether the numbers put out there as being the total staff strength of Cocoa Board, he can determine himself that, okay, yes, you said you have XYZ number. Okay, upon the HR audit, I see that this is the number. Okay, so if this is the number, let us now deal with the efficiency of each staff of Cocoa Board, because there could be the possibility that people are being paid for no work.
However, Deputy General Secretary of the General Agricultural Workers Union, GAWU, Dr. Pascal Kaba, argues that a pay cut alone may not be enough to resolve Cocoa Board's challenges. He is calling for broader stakeholder engagement to develop sustainable solutions to the board's problems.
There's need for there to be broader stakeholder consultation between the parties that have to do with government, Cocoa Board itself, and the unions in terms of looking at win-win solutions to resolve the issues. There are certain welfare issues, there are certain motivational issues, there are certain things which when the three parties sit, we can see what are the cuts we can put in place, what are the measures we have to put in place to ensure efficiency but still reduce expenditure.
Meanwhile, the Executive Secretary of the Civil and Local Government Staff Association, CLOCSAC Ghana, Isaac Addo, says organized labor will take up the matter with government and Cocoa Board management to ensure lasting solutions are found.
Has come about because we think there was nothing like institutional memory and the attitude that you find now, if one person comes, he will clear everybody. That is what has caused these issues. To us, is that cocoa farmers are workers and they have rights. The CEO could have decided that, okay, I agree, I want my salary to be cut. What about the farmer? As he agreed, it's a matter for negotiation. And I think organized labor, this is an issue that organized labor should wake up.
Meanwhile, some cocoa farmers in the Western North region have demonstrated in Sefwiyoso over the recently announced reduction in the producer price of cocoa.
The farmers marched through the main streets of Sefwiyoso calling for immediate government intervention. They argue that the new price does not reflect the rising cost of farm input, transportation, and the general cost of living.
Our concerns. Reduction in cocoa price. The downward adjustment of cocoa price has severely affected our livelihoods. The cost of farming inputs, labor, transportation, and agrochemicals continues to rise. Yet the price paid to farmers has been reduced. The general cost of living in Ghana continues to increase.
The demonstrators say cocoa farming, which once provided a decent livelihood, is gradually becoming unprofitable. They warn that if the situation is not addressed urgently, many farmers may abandon their farms.
And away from the cocoa sector, a joint operation by the Customs Division of the Ghana Revenue Authority and the National Security has intercepted 12 out of 18 articulated trucks evading taxes valued in excess of 85 million cedis. These trucks were declared as transit goods from Akanu destined for Niger through Kulungugu, yet were moving without the required customs human escorts, a major breach of transit procedures. A report by George Queenan.
The major enforcement operation was carried out between 10 p.m. on Wednesday, February 18 and 5 a.m. Thursday morning along the Dowenya-Tema Road. The intercepted trucks were loaded with 44,055 packages of edible cooking oil, tomato paste and spaghetti. Trackers in the trucks were disabled. These are the trackers that are fixed on these vehicles to ensure that their movement or the specific routes they are supposed to take are monitored. And so if there's any detour or any illegal movement, that can be monitored. The GRA says it will continue to safeguard the integrity of the transit regime and also block all revenue leakages. An initial assessment revealed that it was worth about 2.6 million cedis in taxes. However, a reassessment put the actual value due to the state in excess of 85 million cedis, a huge revenue leakage that the Deputy Finance Minister, Thomas Janko Ampim, finds troubling.
We have seen deliberate attempt to steal from the state. The leakage through our customs operations is so much that we are taking serious exception to this. And so we are going to continue with this collaboration between the national security and customs officials to make sure that we nip this in the bud.
He further directed GRA to launch an investigation and report with results within a week.
We are told that 2 customs officials were expected to accompany, to escort these goods that were purported to go all the way to Niger. Unfortunately, they were not. we will want to find out why.
Commissioner General of the Ghana Revenue Authority, Anthony Kwesi Sapon, explained that the law of confiscation will be applied and proceeds placed into state funds.
Confiscation will mean that we will take the full value of the goods, the realization of it, and place it into state funds. And that will ensure that we are taking away the capital of the people who are involved as a warning to all those who plan to do such activities. So again, we'll plead and we'll ask businesses to conduct themselves in a manner that follows the law.
GRA further assured that updates will be provided as investigations progress.
In other news this evening, following the death of a 29-year-old man after being denied emergency care at 3 major hospitals due to the no-bed syndrome, the Director General of the Ghana Health Service, Dr. Samuel Kaba Akoria, has directed all health facilities to administer first aid before referring patients to other facilities. With this not being the first incident and amid public backlash, the Health Minister has set up a committee to investigate the matter. There's more in this report.
On February 18, a directive signed by Director General Dr. Samuel Kaba Akoria ordered all regional health directors to immediately tighten security and patient care systems nationwide. The move follows the alleged abduction of a newborn at the Mamprobi facility in Accra. A 33-year-old suspect, Latifa Salifu, has since been arrested and is currently in police custody awaiting prosecution. The incident has shaken the public. And here are the key measures announced by the Ghana Health Service. Immediate reinforcement of comprehensive security measures across all facilities. Mandatory wearing of uniforms and visible name tags by all staff at all times. Dedicated and continuous staff presence in postnatal wards. A mandatory discharge verification system before any baby leaves a facility. Upgrade and routine maintenance of CCTV surveillance systems, intensified staff training on security awareness and enhanced patient care standards. The Director General has specifically emphasized one critical point. Every hospital staff member must wear their uniform and visible name tag for easy identification.
This is non-negotiable that all health facilities is just a reminder, we are reiterating it, should always all health workers should be in their uniform and name tags for easy identification.
On paper, these measures sound robust, but the public debate is shifting toward enforcement and oversight. From a stolen newborn to a patient reportedly dying over the lack of a hospital bed. A 29-year-old man, Charles Emisa, reportedly died after being denied emergency care at 3 major hospitals in Accra over claims of no available beds. Emergency responders from the National Ambulance Service attended to the patient after a hit-and-run accident, but he was reportedly refused admission for nearly 3 hours before his condition worsened and he died. The Minister of Health, Kwabena Minta Kando, has established and will chair a committee to investigate the exact circumstances of the case. The probe, which began on Monday, February 16, is tasked with interviewing hospital administrators, emergency staff, ambulance personnel, and other stakeholders to determine whether the death was due to capacity issues, referral breakdowns, or protocol failures.
Already we've given some directives. All hospitals should always, no matter the situation, receive the patient, give first aid, and be responsible to call the next facility for referral.
The directives have been issued. The committee has been formed. But beyond the paperwork and press statements, Ghanaians will be watching for one thing, a real change. Because in healthcare, every lapse carries a human cost.
The Ghana Tertiary Education Commission, in collaboration with the Ashanti Regional Police Command, has shut down the Royal Nursing College in Kumasi for regulatory breaches. 2 staff members are now behind bars.
The exercise, which was carried out on Thursday, forms part of what authority described as a regulatory enforcement operation. According to Jute, preliminary investigation uncovered multiple irregularities, including the running of unaccredited programs, non-compliance with approved tertiary education standards, and other administrative breaches. Police officers were deployed to secure the campus, while 2 management staff, including the wife of the founder, were taken to custody to assist with investigations. The Royal Nursing College has a student population of over 800. A level 300 general nursing student, Abdullah Rashid, described the incident as devastating.
So they told us that to go home, they'll close the school, and they'll work on their possible best to repost us on different institutions so that we'll go and further our education. Right now, I have nothing to do.
Where are you coming from?
I'm coming from North, Upper East, Boku, at a community with the younger.
The Ghana Tertiary Education Commission has assured the public that investigations are ongoing and that measures will be outlined to safeguard the academic progress of affected students. The closure adds to growing concerns over unlicensed and non-compliant tertiary institutions operating within the country.
Let's turn our attention to other stories now. And every year, women lose their lives to cervical cancer simply because it is detected too late. Yet, the disease is preventable and highly treatable when caught early. However, limited screening services and a shortage of trained health workers continue to stand in the way. Authorities say health workers must be equipped with the necessary skills and training to enable them tackle this public health crisis. Samuel Yabua Adams reports.
Cervical cancer is a major health issue in Ghana. It ranks as the second most common cancer among women, with about 3,000 new cases and 1,800 deaths recorded annually. However, limited screening services and the shortage of trained health workers continue to stand in the way of timely diagnosis. At the forefront of effort to change this narrative is Dr. Kofi Efa of the Catholic Hospital Cervical Cancer Prevention and Training Center. Dr. Kofi Efa is passionate about training health workers to help eliminate cervical cancer.
Training in Ghana has traditionally been more theory-based. So we developed a practical approach to cervical cancer prevention, equipping people with not health workers, with not just knowledge, but also skills in cervical cancer prevention. We hope that women will not travel more than 5 kilometers to get access to cervical cancer prevention skills.
The Director General of the Ghana Health Service, Professor Samuel Kaba Korea, during a visit to the Catholic Hospital Cervical Cancer Prevention and Training Center, reaffirmed the government commitment to replicating the training modules nationwide.
We don't need to reinvent the wheel when somebody is already doing something so good within our country. So it's part of the reason to look towards a very successful free primary healthcare implementation with homegrown solutions that have come over the years, because he's been doing this for 9 years, and it's part of how to get to understand some of the intricacies and the challenges he's faced. So when we are rolling it out, it will not be a challenge.
For the Executive Director of the Christian Health Association of Ghana, Dr. Peter Kwame Yabua, training health workers to screen for cervical cancer is crucial to prevention efforts.
Service provision is very important, but as well also the training and development of the next schedule of healthcare professionals is very important, including research and development.
Last year, Ghana launched a nationwide human papillomavirus HPV vaccination campaign targeted at girls aged 9 to 14 years to provide life-saving protection against cervical cancer, encouraging parents to have their daughters vaccinated, improving screening services, and training more health workers are critical steps toward winning the fight against cervical cancer in Ghana.
In more news tonight, the Military High Command has assured traders and residents along Ghana's border communities of its readiness to respond to any terrorist threats along the country's frontiers. The assurance comes in the wake of a recent attack near Ghana's northern border with Burkina Faso. Speaking to TV3 during a visit to the 37 military hospital where 3 surviving victims are receiving treatment, the High Command called for vigilance across border areas.
The delegation included the Chief of the Defense Staff and the Chief of the Army Staff who interacted with the victims and medical personnel. The military leadership reaffirmed its commitment to safeguarding Ghana's territorial integrity and preventing any spillover of extremist activities from neighboring countries. Later, the Minister for Foreign Affairs and Regional Integration, Samuel Okudzeto-Ablakwa, arrived at the hospital alongside other government officials to express solidarity with the victims and assure them of government support. Speaking to TV3, the Military High Command reiterated its preparedness to combat any terrorist attack along Ghana's borders and urged citizens to promptly report suspicious activities to security agencies.
Since the unfortunate incidents, on Tuesday, the Ghana Armed Forces was tasked to evacuate our colleagues, our brothers and sisters, and so Tuesday evening, we brought 3 of them from Burkina Faso. 2 are critically injured, and so they are currently receiving treatment at the 37 military hospital.
We and some of the course of channels, Mamma and our Saudi Arabia, the Senate, Obadi, India, Domi, Adomia, a sign about now,